Good evening and welcome to tonight's presentation, Coping with Chemo Brain. Thank you for joining us. We look forward to providing you with more information about this important topic. I'm your host, Sarah Richardson, Oncology Marketing Specialist with the Franciscan Health Cancer Center. This evening, as we hear from our experts, Darcy Hughes and Bridget Kress, you will better understand what defines chemo brain and why it happens, signs and symptoms to watch for, and treatment options available. Before we get started, I'd like to share a few housekeeping items. For this virtual event, participants are muted. We ask that you remain muted to help us avoid background noise and interruptions. If you have questions to ask the presenter, please click the Q&A icon at the bottom of your screen. You can privately type your questions in this window and we'll be answering at the end of the webinar. If you have a personal question that's specific to your own medical history, please note we may reply by phone or email after the webinar is over to protect your privacy. Our awesome administrator, Kirsten, is taking care of everything on the back end this evening. If you experience any technical issues, just type them into the chat window and we'll work to resolve them as quickly as possible. If you miss anything, no need to worry. We'll send the recording of tonight's presentation to you in a follow-up email. Now, let's get things started with a quick poll question to see why you decided to join us this evening. We'll have additional poll questions throughout the webinar to check on your learning. Let us know, what sparked your interest in attending this webinar? Is it A, I'm currently in cancer treatment and want to learn how to curb the cognitive effects of my treatment, i.e. chemo brain? B, I'm a cancer survivor and want to understand why my brain fog and other issues are still a problem for me? Or C, I'm a caregiver and I'm looking for ways to reduce the stress and anxiety of chemo brain for my loved one. I'll wait just a moment for everyone to select their answer. All right, thank you to everyone for participating in our first poll question. I think the answer will pop up here shortly, but I'm sure there are a lot of reasons that people have decided to attend this webinar. We're glad you've taken that first step to learn more and take control of your health. Franciscan Health is home to some of the country's most well-respected physicians and clinical specialists. I'm excited to introduce you to two all-stars who will be joining us tonight for this session. Darcy Hughes graduated from Ball State University with a master's degree in speech-language pathology and has been with Franciscan Health her entire 14-year career, working solely on the inpatient rehab unit. She has a passion for the cancer population and enjoys helping patients and families during their journey. Darcy has a new interest in neurosurgery and is working with a surgeon through our partners at Goodman Campbell Brain and Spine. The goal of this new passion is to be part of awake craniotomies at Franciscan Health to perform tumor resection and maintain speech functions, all while the patient is in an awake state. That's super impressive, Darcy. When she's not working, Darcy enjoys spending time with family, loved ones, and her dog. The great outdoors is her happy place where she recharges after work. Bridget Kress is a registered occupational therapist who graduated from the University of Indianapolis for both her undergraduate and graduate degrees. Bridget has been with Franciscan Health for 9 years, with 8 of those years spent in the acute rehab unit. When evaluating and treating patients on the hospital side, she loves going to the oncology and bone marrow floors because patients work so hard and are willing to do what it takes to get home and stay out of the hospital. Bridget says seeing cancer patients gain their independence back after being sick is an incredible thing to witness. Working with oncology patients sparked Bridget's interest in cancer rehab, and she's been taking continuing education courses to further her knowledge in that area and better serve our patients. When she's not working, Bridget spends time in the gym, where she competes in powerlifting and weightlifting. She also loves hanging out at home with her dog Penny and watching and going to sporting events with her friends and family. Please join me in welcoming our experts, Darcy Hughes and Bridget Kress. Bridget, take it away.
Hello, everyone. Thank you for joining us. I'm going to kick things off by just talking about what occupational therapy, or OT for short, is and our role with cognition. And then I will pass things over to Darcy, and she will dive more into what chemo brain is and how speech therapists can help. So to start, what is occupational therapy? I took this quote right from the American Occupational Therapy Association website, and it is defined as occupational therapy is the therapeutic use of everyday life occupations to support occupational performance and participation. So basically, anything you do throughout the day that includes bathing, dressing, toileting, leisure activities, work, cooking, laundry, just anything that you would do on a regular basis. What is functional cognition? This is how a person uses his or her thinking and processing skills to complete daily and meaningful tasks, both in the home and out in the community. It's important in order to assess safety and someone's ability to fully complete these tasks and leisure activities as independently as possible. How is cognition assessed? I typically work in the hospital, so I'm just going to kind of run you through what a normal evaluation looks like. And this could be just not only for cancer patients, but anyone in general. The big chunk is through discussion. So we sit down, I kind of ask questions about what was happening before the person got sick or injured. We talk about home setup, what they were doing beforehand. And that's where I kind of get a big chunk of when things are starting to go wonky, as I like to call it. People will tell me they can't concentrate on their activities like reading or doing word searches and crossword puzzles. They can't remember how to play their favorite game anymore. We get a little bit more info during these kind of evaluations, and you might interact with your doctor because they're not in there very long, and you have such important things to talk about. Next, just through observation. So a typical session for me would be I help a person get cleaned up for the day. So we will do bathing, whether that be a sponge bath or a shower, and then get clothes on and brush teeth. And I'm watching if the person is able to bathe everything necessary, or if we're spending more time on one part than the other. Are we forgetting something completely? Are we putting clothes on backwards? Are they inside out? Are we forgetting to button them? Do we remember how to tie our shoes? You can really kind of gauge a lot about what someone is kind of lacking just by watching them function, doing typical tasks. And then the next part, if I'm seeing some red flags pop up, I will do a cognitive assessment. The cognitive assessment that we typically use here at St. Francis is the Montreal Cognitive Assessment, or the MOCA for short. And it's broken up into different categories. It typically looks at short-term memory, visuospatial abilities, executive functions, attention, concentration, working memory, language, and then your basic orientation to time and place. Each of these sections is given a numerical value. It's scored out of 30 points. A score of 26 or higher is considered normal. This is what the assessment would look like. And I'm sure some of you are thinking, I have no idea what executive functioning means. So let me kind of break these down a little bit for you guys. Executive functioning would kind of look at your planning, organizational skills, problem solving, self-control, self-monitoring, flexible thinking, short-term memory, following directions, dialing a phone number, simple recall. Working memory is able to manipulate information. So remembering what you're doing if you get interrupted. If you're in the grocery store going through your shopping list and you run into a neighbor, do you remember where you're at on your list, or do you have to kind of backtrack and kind of figure things out from the beginning all over again? Visuospatial skills. Are you able to visualize how things fit together? Jigsaw puzzles. Can you look at a picture and put the pieces together? Another good example is if you are trying to put together an IKEA desk and you're looking at the instructions, can you look at the 2D diagram and then put those parts together in the 3D form? Based on this score, if we're under 26, that's when I'm getting the speech therapist involved. I will message the doctor and say, hey, we got to get someone in here to do a little more digging, a little more assessments, and then they can really kind of jump in and help treat these patients. I will still work with the patient. I will still work on problem solving and sequencing and memory to kind of get them through their daily tasks. And Darcy will jump in and do more education and strategies to kind of help keep this up.
Thank you, Bridget. We're going to have a quick pause for poll question number 2. Now that we've heard a little about our topic, please answer the following. Which of the following are part of the Montreal Cognitive Assessment? A, attention, concentration, and working memory. B, orientation of time and place. C, language. Or D, all of the above. Take just a moment and select your answer, please. All right, so if you answered D, all of the above, then you are correct. In addition to these symptoms, short-term memory and executive functions are also assessed and scored. So let's get back to our experts for more information on how cancer patients are affected and possible causes of these cognitive issues. But don't forget to write your questions for our experts by clicking the Q&A icon at the bottom of your screen. We'll do our best to answer as many questions as possible at the end of our presentation.
Great. Sarah, thank you so much for the introduction, and Bridget for kicking off our webinar this evening. First, I'll discuss the role of the speech and language pathologist, or speech therapist for short. I will also further discuss what cancer-related cognitive impairment involves, as well as strategies that can help someone who may be having difficulty with memory and word finding. According to the American Speech and Language Hearing Association, speech-language pathologists work to prevent, assess, diagnose, and treat speech, language, social communication, cognitive communication, and swallowing disorders in children and adults. I often tell people that our title is very deceiving when it says speech therapist or speech-language pathologist. It really only is a small portion of what we work on. I often describe to people that we have kind of a chest or neck up area of practice. For the webinar this evening, we will be discussing the cognitive changes and some of the language changes that can occur with a cancer journey. So when we discuss cancer-related cognitive impairment, it actually goes by many different names. So we may refer to it as chemo brain, chemo fog, cognitive dysfunction, and I've even heard chemo-related cognitive impairment. In general, it is a change in the cognitive language skills that can occur both during and after chemo treatment. Now, here it says chemo treatment, but I think it's maybe more all-encompassing if we say cancer treatment. For some patients, the symptoms may resolve fairly quickly if they're involved with an occupational and/or speech therapist. But there's also some cases where I think it can last a lot longer, maybe even years, where some people say they still have difficulty with their memory, even with word finding, even if they're in remission. I think it's also important to note, too, that the symptoms can also come up early on during a cancer journey, but they could also come up later. Just because someone starts chemo doesn't mean that they're going to notice cognitive or language changes, but depending on the duration of chemo or the duration of someone's treatment, either immunotherapy, radiation, or whatever it may be, then symptoms might come up later. So even if you notice symptoms later, it is still important to bring them up with your doctor. So the table that we have here and what we'll discuss this evening are more of the common changes that people report. I think also Bridget and I, these are maybe the more common that we see as treating therapists. I often hear people describing that they're having difficulty with their short-term memory or mild forgetfulness. Also the word finding, that really terrible tip of your tongue feeling where someone might not be able to express their needs because they keep losing their train of thought and their words. We do also see in some maybe more severe cases. I can think of an example where someone was taking medications that had a neurotoxic effect, unfortunately, that they were quite disoriented. So those symptoms can occur, but of course, these things can be worked on in therapy, but also it's important that your medical team or your oncology team is aware of these symptoms as well when you experience them. So let's talk about some of the possible causes. Currently, there is no known specific cause for cancer-related cognitive impairment, but it is suspected to be possibly from multiple causes, which I have listed here. As we know, many patients are experiencing a lot of these different types of treatments or maybe even surgery during their recovery. It's not okay. Maybe in some cases, it might be someone's gone through chemo treatment and then they're in remission, which is wonderful. That's what we always hope for. Or maybe it's a surgery and then the tumor's been removed and everything's okay again. But let's be honest, in the cancer recovery and in the journey, there might be a lot of different phases someone's going through. So each of these that I have listed here individually can cause cognitive changes or even language changes. But again, I think it's more of a multifactorial situation. I also have listed here depression. Unfortunately, we know that this is a very common diagnosis or situation amongst the cancer population. Depression alone, someone might have difficulty with short-term memory, lack of interest, maybe they're off schedule, they're sleeping more, and they might even have difficulty with processing on a daily basis. So let's discuss something that's obviously really, really important is when you notice these symptoms, what should you do? So I think the first thing I want to touch on is I often tell my patients that when they notice these symptoms to not be ashamed. I have so many people, and it breaks my heart. They tell me, I feel stupid. I feel like I've gone crazy. What's happened to me? No one told me this was going to happen. I try to reassure them that they're not alone. Your loved ones are not alone. Patients that are, participating on this webinar, you're not alone. It's something that I think we're learning more about in the medical field, which is really important. So when you notice symptoms, don't be ashamed. Try to make note, is it affecting your daily life? Are you forgetting to go to doctor's appointments or taking your medications, which maybe is abnormal for you? Are you having communications with family members or conversations with family members, and then all of a sudden you lose track of your words and then the communication or the conversation ends? If it's affecting daily life, I really encourage people, number one, tell your doctor. Some of the patients that are in the hospital, I tell them, I want you to tell anyone that walks in this room, let them know that you're having difficulty, the nurse, the case manager. Like Bridget mentioned, there are times that our occupational therapists or even physical therapists are the first ones in the room. And that's a wonderful opportunity to talk to them, let them know that you're having difficulty. I also encourage people, make sure that in your journey, you're requesting that head to toe approach, that whole body rehab treatment team recovery. Again, having someone like Bridget come into the room to help with activities of daily living, jobs that you need to do to take care of yourself, having a physical therapist come in to work on ambulation, walking, balance, making sure you're moving about your environment safely is really important. Then obviously back up to the head and neck approach, the speech therapist coming in to work on cognitive and language changes that may be occurring during the journey. It's very important to advocate for your needs. So again, I kind of jumped ahead. Big word, advocate. So important. Don't feel bad if you're having difficulty. Make sure that you speak up. Again, this is a growing area of interest. It's a growing area of need. And not all medical teams are aware of the importance of even a rehab treatment team in the cancer population, let alone a speech pathologist or an occupational therapist coming in. We'll start to discuss further if symptoms are occurring. It is really important to start using strategies to help yourself or also to help, a loved one with their journey, because using strategies on a daily basis can help reduce frustration and maximize quality of life.
Darcy, you're offering some really great information for our participants, and we're all learning so much. As we're wrapping up our presentation for the evening, let's do one last poll question to recap this past section. True or false? Cancer-related cognitive impairment, also known as chemo brain, always presents itself during treatment. Just take a moment and select true or false, please. All right, if you answered false, you are correct. Cancer-related cognitive impairments can happen during or after treatment and with a variety of severity. As we've learned, some patients report issues before they resolve themselves, while many others suffer long-term symptoms and can benefit from treatment with experts like Darcy and Bridget. Now let's get back to Darcy to wrap things up before we get to your questions this evening.
Great. Thank you so much, Sarah, and thank you for everyone's participation in our poll questions. So in this webinar, we are going to discuss various strategies. For this webinar's purpose, though, we are going to discuss some of the more common areas that people have difficulties. So we will be discussing memory strategies as well as word finding strategies. However, patients may also need to be considering strategies or utilizing strategies for things like relaxation, improving sleep, or even attention. I think we could probably do a whole nother webinar just discussing those three areas and strategies that could be used. So first, we'll touch on word finding strategies. So the strategies listed here are designed to help patients come up with the words that they're looking for. Kind of like I mentioned earlier, it's that really awful tip of your tongue feeling. You know exactly what you want to say, but the word just completely escapes you. I present this list as a handout to my patients when I'm beginning to work with them. And I say to them, choose the strategies that work best for you. We literally go from the top of the page to the bottom. I have them mark which ones work best. Not every strategy will work for every individual. So it's really important to have the loved one, the patient, involved in choosing the strategies that work best for them. First, we'll discuss delay. This is a simple one, but actually a very effective one. Sometimes just pausing. Take extra time. Even some patients, to tell them, close your eyes, and it helps them come up with the word they're looking for. Also, describing. Give your listener more information about what you're trying to say. Again, this is a conversation. So the more you can give your listener, the more you're helping yourself come up with the word, but also then your listener may be able to help you. As loved ones, though, I often encourage, try to let your loved one come up with the word they're looking for before you jump in and give them the word. The more they're trying to rebuild those skills, the better the outcome. Making an association is another really good strategy. Try to think of a related word, even if it's not exactly the word you're looking for. Synonyms. I think in our English language, we have probably 5 words that mean one word. So, for example, if you can't think of the word tissue, you could easily say Kleenex, and there will be no communication breakdown, and your listener will know what you're looking for. Gestures. So we can kind of go back to the days when we were playing charades. Using your hands is actually a very effective form of communication. Drawing is pretty self-explanatory. You could have a pen and paper and maybe help you come up with the word you're looking for. Looking it up. So many of us have the internet at the tip of our fingers now. If you get enough kind of keywords into your search, you might actually be able to come up with the word or topic that you were looking for. Also narrowing it down. Maybe try to think of the general topic or category of the word, and that will help you generate the word you're looking for in conversation. This last one, I think, is actually one of the more important ones. When it comes to communication, this list of strategies is designed to help avoid communication breakdown. That's the last thing we want. That's what creates frustration for both the listener and the person communicating. So there may be times that you can't come up with that word. It's important to say, you know what, I just can't think of it right now. I've lost my train of thought. You could take a break. You could leave the room. You could change the topic, but always try to come back later to make sure that you're getting your thoughts across. And then maybe you'll be able to come up with the word you're looking for. Now we'll discuss some different memory strategies. Again, like we've discussed earlier, memory is a very common area of difficulty for patients, often when they discuss short-term memory, having difficulty remembering what the doctor, having difficulty remembering what they ordered for, or what they, if they had taken their medications or not. So when it comes to memory, we'll discuss it in two different parts as far as strategies, both internal and external memory strategies. And again, like the word finding strategies, I tell all my patients and loved ones, make sure you're utilizing the ones that work best for you to help maximize the patient's independence and quality of life. For internal memory strategies, these are things that we can do mentally or internally to help us recall something. So the first one listed here, repetition. You can mentally or even out loud repeat something to yourself to help you remember it later. Maybe a name, for example. Association. This is one where you're making a connection. So for example, if you meet someone, and they have a similar name maybe as your best friend, for example, then later on you can make that connection and say, oh yeah, I met someone today and her name is the same as my best friend. And then you can come up with that name without difficulty. Also, writing information down. This is a little bit of an internal strategy that then we're making external. So you're taking kind of the thought that you're thinking of and you're writing it down. But there is a lot of research out there too that even our muscle memory, so writing something can help you remember it later on. I often, for me, actually visualizing is a great strategy. If you can picture what you're trying to think of, if you can kind of replay a scenario, how many of us have lost something or misplaced keys? You're almost picturing in your mind your last steps and where you were before you got to the point that you lost them. Also putting things into categories. Try to figure out that general topic or category of the information you're remembering and that you need to remember, and that might help you recall it later. Also describing. Again, if you can't remember something specific, if you can start describing or talking about it, that may help you. Chunking. This is a strategy that often we utilize for recalling numerical sequences. So for example, an account number, maybe an employee ID number. Chunking is often a strategy that patients will use. Now we'll discuss external memory strategies. So external obviously means things that are outside of us or in our environment that can help us remember information. So for many people, they benefit from a written system. This may be a calendar or a day planner, for example. Organization systems. A very popular one is using a pill organizer. That way all the pills are there, and if you open it and it's empty, you know you've taken your medications. Another example of organization system is maybe if someone forgets where they put items, you should put items. You could label shelves, drawers, things like that, just to help someone remember where they put an item or where they find an item. Posted reminders or checklists are very helpful. I suggest to some patients that if they have trouble remembering what they need to do for the day, or maybe items they need to take with them, like posting a sign at the door. Do you have your keys, wallet, glasses, almost like a checklist that they see very last thing before they leave the room or the house. Also different environmental support. So an example of this might be if you want to water your flowers in the morning, but before you go to bed, setting out the watering can, set it on the porch or on the counter. That way you remember as soon as you see that watering can that you were supposed to water the flowers. Time reminders. We all have alarms, our phones, our watches. We can set alarms to help us remember different things of when to wake up in the morning, when to get ready for a doctor's appointment. Also, maybe trying to remember when to take your pills. I often suggest the patients to make sure they set an alarm. The last couple I think are very important. Asking others for assistance. I think this is okay. Sometimes you get to that point, you do have to ask someone to help you remember something. Maybe if all the strategies above or even some of the internal memory strategies aren't helping, it's okay to ask. That's why we have our loved ones. That's why we have our friends. You know, maybe if there's something that slipped your mind, they can help you. Maintaining a routine. I think this is one of the most important, but at the same time, I know everything when it comes to a cancer recovery or journey is everything but routine. But if there is a way that you can find or help your patients find a routine during the day, that this is very beneficial. So when it comes to treatment options to help cancer-related cognitive impairment, currently, there are known standardized treatment options. This is an area that is being researched, so hopefully that statement may change in the future. I think that it's wonderful that there's more awareness of the cognitive changes that can occur in the cancer population. It is something that is even new to me since I began my career. I feel like this wasn't a topic that we discussed when I was in college, but it's something that I have a great passion for now. And always, again, advocate for your needs. Make sure that you're speaking with your medical team to get that care that you deserve. There may not be, a cure-all pill, but at the same time, it's important to remember that there are resources available to you and to your loved ones and to our patients. So in conclusion, the cognitive and mental well-being of our patients is essential during their journey. There are resources and strategies that can help them maintain the best quality of life possible.
Thank you so much, Darcy and Bridget. I think we all have learned a lot about how cancer treatment can affect patients and survivors, and that there are treatment options that provide hope and improve quality of life. I know we could have spent a lot more time on each topic, but we hope to get even more information as we head into our question and answer session. We've received some good questions sent through the chat, so let's dive into those and see what the audience is interested in learning more about. Our first question is, in older cancer patients, how do you know if cognitive issues like chemo brain are a result of treatment or if something else is the culprit, like maybe dementia or Alzheimer's?
That's actually a great question. I think what I tell loved ones and the patients to look for is it different than your baseline? So when I describe baseline, that's, how you function on a daily basis. If there is a change from that, and it may take a while to notice, because many factors in life can kind of change our cognitive abilities from illness to lack of sleep to stress. But if it's a change from baseline and it's consistent, I think that's when it's an important to make note and inform the doctor right away.
Thank you, Darcy. Our next question is, when talking about therapy sessions with a therapist like each of you, how many sessions might it take to see results for chemo brain issues? I'm sure it probably varies person to person, but what's maybe an average people could expect?
I think that might differ for both OT and for speech therapy. If I'm seeing someone, and keep in mind, we see patients in the hospital setting, not in the outpatient setting, where I think most of you would be seen if you need help with these issues. As long as they're able to do their daily tasks safely and as independently as possible, I would probably discharge them. So I may see them twice, 3 times, maybe 4 if it's once a week. I think Darcy would keep them longer if they're having more cognitive difficulties with different areas outside of just their basic needs. Darcy, do you want to add a little more to that?
Yeah, Bridget, I agree with you. I think that it really does vary. And like she mentioned, our view is more of an inpatient setting where we have the wonderful but brief ability to work with these individuals and their loved ones. I do work with people where I feel like from a 5 day a week perspective, we see recovery or improvements at least within 2 weeks. But again, kind of like we mentioned within the webinar, there are people that have long-standing effects throughout their journey or even later on in their journey. The key as a therapist for Bridget and myself, we want to make the patient their own therapist, find ways to use those strategies so they can be independent on their own. But yes, I think the recovery can really vary. It might be a few weeks, but for some people, it's going to take longer. And it really depends on their cancer journey. Do they still have chemo lined up? Are they still lined up for a surgery? Then it might exaggerate those symptoms again once they start that new course of treatment.
Thank you so much. Our next question, we had a couple people who kind of had a similar question. They are cancer free. One's been out of treatment for about 4 years. One's been out of treatment about 10 years. They're still having short-term memory issues where they can't remember words. They can't remember movies they've watched. They're wondering, is there anything that they can do now? Is it possible for them to still come in for therapy and receive that? Or they're asking, is this just their life now?
Well, that's a great question. I think I'll go ahead and answer, and then Bridget, if you want to add, please do. I think the hard part is when you're years out, but that's great as far as remission. What a wonderful story. I think for some people, it's a long standing. It's kind of where they're at. It may be something I still think it's important to talk to your doctor about. Um, as far as getting therapy and will insurance approve it or do they consider it a chronic condition? Hey, it's at least a try. Um, Outpatient services are obviously offered with an occupational therapist. You can see a speech therapist in the outpatient setting. If your doctor looks at you and says, "Why do you want to see a speech therapist?" Tell them about this webinar. Say, wait, they work from the neck up. They do work on cognition. This is definitely within our scope of practice. I think it's okay to ask. I also think, though, it is okay, really try to use those strategies during the day to help yourself with your memory, writing information down or keeping a log, keeping a daily journal. If some of those strategies aren't working for you right now, maybe try something different and see if something else will help. But speak with your doctor about it and maybe advocate for some outpatient therapy if possible.
I completely agree. The worst they can say is no. At least you're trying. Like Darcy said, you've got to be your own advocate. It doesn't hurt to try, and maybe whichever speech therapist, they can give you different strategies that Darcy may not have touched on. But I definitely think it's worth a shot. I don't think you have to live like this. I feel like there is some way that you can maybe not get everything back. 100% is shooting for the stars, but if we could even get 80 to 90%, I still call that a win.
Thank you both so much. I think that's good to just give a little bit of hope. And I know you've given some great nuggets and tips for people to try at home tonight to get them started. Our next question, can you go, each of you, into a little more detail on what you would do with someone in a therapy session?
So I mentioned briefly about kind of the evaluation portion. So we sit and we chat and we hang out for a little bit. And then the next part of my evaluation is seeing how you get yourself ready for the day. After that, and we find out there are some things that we can work on cognitively. I will take them into the kitchen. I will see how safe they are with the cooking task. We will talk about strategies to remember to turn off the stove or remember where items are at. Like Darcy said, labeling and identifying locations is a great start. I personally love jigsaw puzzles. So if my patients like them, I have them do them because they just work on so many things, your visual scanning, your problem solving, your sequencing, organization, attention. So I just recommend anything like that, even if you're at home, just kind of work on these little games. you don't want to feel like you're a kid, but this stuff does help. And so I really just have people use their hands. We're building things, we're taking things apart. I'm making sure you're safe moving around your environment. And I just kind of change things up each day.
From my perspective, a session kind of looks like, in some ways similar to Bridget, there's a lot of research out there now within my field of speech therapy is the importance of function, making it very applicable for the patient. I love to work on medication management. There's so many different things you can incorporate with that. Some of my initial sessions with someone, especially being in the hospital setting, I actually review their medication list with them. Um, no, I'm not a nurse. No, I'm not a pharmacist or a doctor, but I've learned from some of the best, in my opinion. And I've taught myself at least many of the medication names, what the purpose, and I'll go through and I'll name and I have the patient say what that, or even just recognition. Do they recognize the medication, or is that a new one that a doctor started a few days ago? It helps with problem solving. I have individuals that identify that a medication is not on their list, and then they look at me and say, wait, but I've been on that medication for years. And well, then we write that question down as a memory strategy. I usually send a message to the doctor. I have the patient advocate for their medical needs, ask the doctor. So that function. We also work on memory. Do you remember what you did during your occupational therapy session? What did Bridget help you with today? Do you remember what the doctor told you? We also do activities like word searches, crossword puzzles. Our phones now have so many different applications that, kind of like Bridget mentioned, they are games. And it's not to make our patients feel like, they're learning again, but at the same time, they're exercising these skills that are impacted during their cancer journey. So, Wordle, we all know about that. That's a very popular one right now. Words with Friends, Scrabble. I think those actually have a lot of purpose and benefit. I still play solitaire with patients. Card games are wonderful. The biggest thing that I would say is I often tell loved ones and patients, do what you enjoy. If you don't enjoy it and you don't feel like it's not something you want to do, then it's not going to work. So you have to have that buy-in. You have to come up with some things that you would enjoy or would like to do, and then make sure you're incorporating that on a daily basis on your own or with a therapist.
Thank you. Those are some really good tips. Our next question comes from a wife who says, what can I do as a caregiver to help my husband with his cognitive issues? He gets so frustrated, and his anxiety and frustration make me anxious and frustrated too.
That's a tough one because as a loved one, you don't want to see your loved one struggle. And it's hard. And no matter which patient I'm telling them, I give them, from my perspective, when we're working on daily tasks, so bathing and dressing. If someone is struggling, let's say, to get their socks on or their shoes on, I have a 2-attempt rule. The patient's got to try twice before family can jump in. Or if I'm working with someone and their word finding is really bothering them that day and they cannot say what they want to say, I tell them when they feel like that's coming on, stop, take a break, reset, try again. As for the loved one, you just have to kind of practice that stuff yourself. You have to sit and, we've got to learn some patience. And I know it's very, very hard, but just take your time, go slow when you're working on tasks. You've got all the time in the world. You just have to take your time, break things down into smaller chunks, focus on one thing at a time.
Thank you, Bridget. Do you have anything to add to that, Darcy?
Yeah, I do. I completely agree with Bridget. I'll just add on a few things. I think that, yeah, it's just the hard part is it happens. It's almost a given from a patient side and a loved one. As the patient, sometimes I actually incorporate in my therapy sessions, because it is within my scope of practice, of sometimes some relaxation breathing techniques, kind of like Bridget said, just pause, take a breath. take 10 deep breaths is what my mom always tells me, or used to tell me when I was a kid. That can help kind of reset and relax, lower the blood pressure, lower the heart rate. Another thing that's important to watch for is the time of day. When we're doing some of these activities, we might be really tired. It might be right after a radiation session or a chemo treatment. You know, if possible, trying to pick an appropriate time of day to do some of these activities might help reduce the frustration. I agree with Bridget wholeheartedly. Slowing down, taking breaks, pause when you need to, celebrate those little independent moments too, because those, are really important, especially during those times of frustration. I think encouraging each other as patient and loved one are important, but also encouraging other family members or other friends to help can also alleviate or give people breaks, with daily activities can be helpful.
Thank you, Darcy. Our next question is, my brain fog affects my sleep, which causes my chemo brain to be worse. It's a vicious cycle. Any advice on getting better sleep?
I can touch on that a little bit. I think that this is a very individual case basis. Everyone's sleep pattern's different, but I think there's a lot to be said for something we call sleep hygiene. So what is the environment like before you go to bed? Have you been staring at your phone or the TV within 10 minutes? There's actually a lot of research out there that's saying it's important to shut off screens or have no screens in front of you for a while before you go to bed. Do you have the lights dimmed? Are you closing the blinds in the evening to help yourself wind down? Also, I actually happen to be someone who enjoys the use of lavender as an essential oil. Now, it's something that would be really important to talk to your doctor about before using something like this. But lavender, for me, actually helps put me back to sleep. There's also some different medications or over-the-counter medications that could be used. But again, speaking with your doctor about this is really important before starting them.
I would also say, and again, this could be another topic on its own, is cancer-related fatigue, that no matter how much sleep you get, you're always just really kind of tired. Movement is medicine. We work with a really great doctor in our rehab unit, and he says research shows that for almost every day one day you're in bed, it takes like 6 to recover or something along those lines. So even when you're tired, doing some kind of movement. Don't lay in bed all day. Now, if you need a nap, that's a different story. Take a nap. Don't take a 5-hour nap. Take an hour nap. Have an exercise program. You don't have to go, all out in the gym. Just doing some gentle movement, yoga, gentle stretches. Any kind of movement up throughout the day should also kind of help combat the sleep problems as well.
Thank you both. That's some good advice. Another question we've just received, someone's asking, does chemo brain kind of lift over time? They have a family member who has gone through treatment and they're seeing some improvement and they're just hoping that it continues. So does it kind of gradually go away, or how does that usually happen for patients?
That's a great question. I think from where, the realm in which Bridget and I work in, we get to work with people for such a brief period of time, but I do love when patients come back and then you can kind of see how they are months out, maybe even years out. So I do see it even within weeks, it will start to lift and improve. Hopefully that is a continuation. I think that's great to hear. Again, kind of like I mentioned, depending on the journey or if there are further treatments, don't be alarmed if you do see it backtrack a little bit. But hopefully, yeah, if it is lifting and improving, I would hope that it would continue to do that. But I can't say exactly for sure since every case is so unique.
I agree. I think, and it also kind of depends on the medication you're taking. So you might go through through chemo and your treatment plan changed, and then you're on this specific medication for however long, and that side effect from that medication is a little bit of a brain fog. It really just kind of depends. Lots of factors play into that. But we do see it lift. Again, it might not be 100%, but any little bit counts. So there might be a little bit of relief to it.
Thank you so much. We have just a few more minutes here for questions. I'm going to ask Darcy a specific question for you. You briefly mentioned swallowing issues. How can swallowing issues affect speech and cognitive functions?
Yeah, absolutely. So swallowing issues are within our scope of practice. As far as with the oncology population, a lot of it depends on what is that diagnosis. Obviously, we're heavily involved in head and neck cancer. Sometimes their primary diagnosis or problem is what's called dysphagia. And again, that's difficulty with swallowing. We have some people that will have difficulty from surgery. So if they've had, a brain surgery, tumor removal, depending on location of the tumor, swelling, that can cause changes in the swallow function. Swallowing and eating is a huge part of our life, as far as our daily routine. And though I don't know that it directly impacts cognition, but it does add a lot to someone's day. If you're not getting proper nutrition, because there is a swallowing problem, obviously that could lead to some complications. So let's say you have a swallowing problem and you're on thickened liquids. You may become dehydrated because you don't like the texture of the liquids. Thus, severe dehydration could lead to actually what we would call altered mental status, or confusion. We have some people that come into the hospital and they're so severely dehydrated because they haven't been drinking. Again, if someone's maybe on an altered diet as far as food textures, maybe they're on a soft diet and they can't eat the things they enjoy, lack of nutrition and malnutrition could possibly affect cognitive skills over time. But hopefully the oncology team is maybe providing some education on nutrition, as well as the speech therapist providing education on quality nutrition to make sure that you're able to eat what's safe for you, but also what's nourishing to your body and your brain.
Thank you, Darcy. All right, we have time for just one more question. Someone has written in and asked, are symptoms of chemo brain permanent? Can they be permanent?
That's a very good question. I don't know if I have the answers to that, if I'm going to be quite honest. Like we said, sometimes these symptoms show up pretty early on in the treatment process. Sometimes it takes a while for them to show up. And again, it depends on what kind of medication you're on. If you're going to be having just to kind of work around this for a while, or if at some point it really does go away. I know I don't have a full answer for that. Darcy, do you have maybe something a little better than that answer?
Yeah, no, I mean, yeah, Bridget, I'm right there with you. I kind of wish we had an answer. I would love to tell you it's all going to go in away in a year and it's never going to come back. Unfortunately, I think we know on a case-to-case basis that's not necessarily the reality. And Bridget's absolutely correct. I think depending on where you're at as far as medications, or again, like I've said, are you scheduled for more chemo? Are you scheduled for a surgery? I think there are times that I don't like to use the word permanent, but there may be more long-standing effects. And like we've said before, might not be able to reach that high mark of 100%, but at least even if there is some improvement, or if you're able to use strategies to help your quality of life, that's what's important.
All right, thank you both so much.
I'm sorry, can we answer? This reaches out to me. There's one more question. It asks if there are any support groups for caregivers. I do believe Franciscan does have a cancer support group, and I believe that is for both people that are going through treatment and their caregivers. I will find out how we can get that information to you all, because this is hard to go through for everyone involved.
Yes, definitely. And actually, we do have a website That's for our entire system. If you go to franciscanhealth.org/events, you can search by the community that you live in. You can search for just cancer education and support groups. And based on the region that you live in, there should be a support group in your area. We also partner with Cancer Support Community Indiana, and they help us with some of our support groups in our region as well. We also have a Moving Beyond program that I'm going to share just a little bit about here shortly, and we'll send you some information in your email. So at this time, I just want to thank our experts, speech language pathologist Darcy Hughes and registered occupational therapist Bridget Kress, for offering so much helpful information about chemo brain and other cognitive issues brought by cancer treatment. We appreciate your time this evening and sharing such important information. Hopefully, everyone on this webinar will walk away with strategies to help yourself or a loved one manage that chemo brain. We encourage you to seek out professional help from experts like Darcy and Bridget to assess your issues and to get the help you need to improve your life during and after cancer treatment. So you can also consider joining our Moving Beyond Cancer Survivorship program. This is a joint venture with Cancer Support Community Indiana. It's an 8-week program led by cancer professionals, and that includes oncology-trained mental health professionals, social workers, nutrition and exercise professionals, oncology dietitians, nurse navigators, and more. Classes are offered both in person and virtually, and we will share some information with you by email after this program. If we didn't get to your question tonight, we'll do our best to contact you using the phone number or email that you provided at registration. And if you'd like to learn more about cancer treatment at Franciscan Health, we encourage you to visit franciscanhealth.org/cancercare. On this website, we have virtual tours of all of our cancer centers in Indiana and Illinois, as well as information about cancer screenings available to you. We know your time is valuable, so thank you for joining us and making your health a priority. After the webinar ends, we'll send you an email with the recording of this session, as well as information about the free Moving Beyond Cancer Survivorship program. Feel free to share it with others who might find it helpful. You'll also receive a brief survey about this webinar and its content. Your feedback is truly important to us and will help us make future seminars even better, so please take a few moments to fill out the survey. On behalf of everyone at Franciscan Health, thank you for being with us and have a blessed evening.